Thank you for sharing your evening with us. We have an outstanding program, two of our finest speakers, and the timing could not be better. As you know, names very familiar, our HR guru, Jody Schaefer, our legal guru, Dan Schulte, and as all of you know who've been paying attention today, the governor came through, gave us the green light. We didn't know this was going to happen today. The timing is perfect. So now, the timing to set the stage for our reopening on the 29th, we're going to have our discussion and answer many questions and a lot that's on our minds as we finally got the green light with regard to calling employees back to work, setting the stage for success, and responding to resistance. Thank you again for being here.
Dan and I have split the presentation into 3 sections, and I'm going to cover 2 of those sections, and then Dan will back clean up. The sections are, first and foremost, how do we prepare to reopen? As your new president had said, the green light has been given and the reopen date has been assigned. It is Friday, May 29th. So a week from tomorrow is when dental practices can reopen for non-emergent, non-essential services. And so I want to make sure all of you are clear about the work that needs to go into prepping your offices before you open those doors. So that's the first part of the presentation this evening. The second part of the presentation is the process you would then go through to formally recall your employees. And then Dan will come in and talk about various scenarios that we've been getting a lot of calls on, both of us, regarding resistant employees. So, you know, the various circumstances that might make somebody resistant, how to respond to those scenarios, and then a few other questions that we've also been getting that have kind of a legal slant to them. And then we'll open it up for questions. So I think the goal here is to get through the content in about 45 or 50 minutes, which would allow a pretty generous period for Q&A. I think we'll take Q&A right up until 8:15 if there are enough questions to substantiate that. So without further ado, I'm going to jump right in. We had a big surprise this morning. I was all set to talk about Executive Order 2020-91, and lo and behold, the governor comes on this morning and rescinds those executive orders and signs new executive orders into place, and the most current of which is 2020-96. And this now allows healthcare providers, including dentists, to begin providing those non-essential services, as I said, on Friday, May 29th. However, it does point back to the previous executive order 2020-91 that was issued on Monday of this week, on the 18th. And that executive order was a standalone order, and it's solely focused on worker protection. And so that is really the roadmap that employers are going to be looking at to determine the kinds of protocols and policies and documents and processes that you have to have ready to go before you open your doors. Now, a couple key points here in this executive order, both 2020-97, and this was also true in the 2020-91 from Monday, that all businesses across the state have to comply with these workplace protection standards. So if you've been seeing patients all along because the services that you provide were considered essential or emergency, you are not exempted from these new rules about having to have a COVID response and preparedness plan, or preparedness and response plan, excuse me, and some other different protocols. So all businesses across the state, regardless if you've been operating or not, need to have these amended systems in place before you open your doors. And then the other thing that's important to note is that these executive orders created enforceability standards that apply to all of these different variations in the work order itself. So it's no longer just the government saying, or the governor saying, these are the kinds of things that you should do. There's now teeth to it in terms of the enforceability. And a lot of it lies with OSHA, but the Licensing and Regulatory Affairs is also one of the agencies that will be tapped in on the enforcement side of this. So I want to do a couple of things here. If you look at the most recent executive order, or if you look at the one that came out on Monday, they're set up pretty similarly. The first section is, here's everything that an employer has to do before they allow in-person work. And this is true regardless of your industry. So that's always kind of the first part of these executive orders. Then the next section in the executive order breaks out additional requirements based on industry. So if you're manufacturing, you have to do these additional things, construction, and then most recently this morning, healthcare, outpatient healthcare, including dentistry. So when you look at this executive order, you're going to want to look at both the requirements for everybody who's performing in-person work, and then additionally, you want to look at the requirements specific for healthcare employers in those outpatient settings. And then the third section of the executive order is what's going to happen to you if you don't comply. So let's look at the requirements that are necessary for all people that are performing in-person work, regardless of industry. The first thing is that you all need to have a COVID-19 preparedness and response plan. This has to be a written document. This cannot just be a collection of different checklists, et cetera, or ad hoc trainings that you've done. It has to be a written plan. And you don't submit the plan to anyone, but you have to have it on hand and available for employees to view, or vendors to view, or OSHA to view, should they come in and want to do some sort of investigation. So you need to have this documented. Now, the nice thing is that there are several organizations out there that have created sample templates that make it very easy for you to customize without having to start from scratch. So I have shared with the MDA, and they will send out after this training, a couple of the sample templates that the Michigan Chamber has been sharing for free. The Bodman Law Group has put those together. The Small Business Association of Michigan just yesterday came out with their small business template, again, for free. It's available on their website. You can download that in a Word document and customize it. And so those templates or links to those templates will be provided to all of you at the conclusion of this webinar. So I would say start there first. Another requirement for all of you is that you have to designate one or more on-site supervisors to implement, monitor, and report on the different things that you outline in your plan. So basically, you have to appoint somebody who's going to be in charge of ensuring that this plan you put together is actually being followed. And those supervisors have to be on site during the workday. So if your office manager, for example, would be your natural go-to designee for this, but your office manager doesn't work on site in that building every day of the week that you have employees working, then you're going to need to designate at least one more person. So it's somebody who's going to be on site when workers are present. Another requirement is that you train your staff on various COVID-19 control practices and protocols before they come back to work. And the executive order outlines 4 key training areas. Again, if you've done the work and developed your preparedness and response plan, that really can become your training document, and you can just work right through that. But the 4 key areas you want to make sure you're covering are your workplace infection control practices, proper use of PPE, how an employee would notify the practice if they had COVID-like symptoms or a confirmed diagnosis, and then what the employer would do as a result. And then finally, how an employee would report unsafe working conditions. Now, you most likely do not want to encourage employees to call OSHA if they think you're doing something that's unsafe. What you would instead want to do is instruct those employees to either contact your designated supervisor who's implementing your preparedness and response plan, or perhaps you as the practice owner. So you want to set up kind of an internal reporting mechanism and encourage employees to use that. One of the best ways to defend against an OSHA, a whistleblower suit or a potential OSHA complaint is to do everything you can to ensure that your employees feel safe, and that if there's something that they identify that feels not safe or feels outside of the plan, that they have a means of telling you so that you can rectify it. So that's kind of the goal here. So those are the 4 key things on training. One note on training, you have to prove that you did it, right? So if you got investigated by OSHA, for example, or licensing and regulatory affairs. And they're saying, well, did you train your staff on COVID? Oh, yes, I did. Okay, well, we'll prove that you trained them. One of the ways you would prove it is that you would have documentation of attendance. So when you do your trainings that are leading up to your reopening, you want to make sure that you've got some way to document the staff that were a part of those trainings. And I would include the content that you trained on as well, even if it's like an agenda or a brief outline of the different training topics. It doesn't have to be every single training document, but you want to have some way to prove that you've done the training. Another requirement for all employers before you resume in-person activities, we've got to get a handle on these daily self-screening protocols. So we have to have a way to ask health-related questions that we would never have asked pre-COVID, but now we have to ask of every employee before they start every shift. So this isn't something that they just complete once or complete weekly. This is every time they start a shift, they're going to be asked the same set of questions. And these questions really are coming from your county health department. They're coming from the CDC, but the county health departments have the ability to put even more stringent protocols in place. So my advice to you is to Google your county health department's website and then look for their employee COVID health screening forms. Most of the counties have developed a printable PDF form that you can use. And some of them are really nice, and they tell you, like, if the employee answers yes to this question, here's how you respond to that. Because we're getting a lot of questions. Do I have to keep them out of the workplace for 14 days if all they have is a fever? Do I have to send everybody home, right? So the CDC is going to control not only the questions you ask, but also what you do in response. But I would start with those county health departments first. Additional requirements for in-person work. Many of these are things that you have already been adhering to because they're required when you go grocery shopping, they're required when you go to the post office, right? And that is adhere to social distancing whenever possible, provide face coverings for your employees, and require that face coverings be worn when the employees cannot maintain a 6-foot distance. Now, in dentistry, you're going to have positions that are more high risk than others. So your dentist, for example, or the assistant or the hygienist that is really close to a patient's open mouth is going to have more risk of exposure than perhaps your front desk staff who might be sitting behind a plexiglass sneeze guard and have more distance between themselves and the patient. So if that's the case, your PPE requirements can vary based on risk profile per position. So you don't have to have a blanket risk profile for the industry of dentistry, but per position. And OSHA has those risk categories available, and I've got a document that I'll share with you at the end of this presentation, just so that you can brush up on those. Another requirement, again, this is common sense, I think, but making sure that you have a cleaning and disinfecting schedule for your workplace and that your high-touch surfaces or your shared equipment is disinfected on a very regular basis. So, many of you probably had some sort of cleaning contract pre-COVID where a cleaning company or maybe a staff member would clean the office once a week. That's not going to cut it anymore. So we've got to ramp up our cleaning schedules and the level of disinfecting that we are doing, but really pay attention to those high-touch surfaces and make sure that you've got some sort of a rotation or a schedule so that those are getting wiped down much more often. Same thing with hand washing. Make sure that we're engaging in frequent hand washing. Perhaps put sanitizer right by the front door so that when your staff come in the morning, it's the first thing they do is sanitize their hands. Same with your patients. And then the last two here that again apply to all is promote remote work to the fullest extent possible. So if you have some admin staff, for example, that do your billing work, and they don't answer phones, they don't greet patients, they do billing, and maybe they do some scheduling or something like that. If that can be done remotely, then you should continue to allow those employees to do that work remotely, assuming they have the equipment to do so. So just because you're getting the green light to go back to work next Friday doesn't mean every single position has to come back next Friday. And then restrict business-related travel. only to those employees that are essential for the travel. So we don't want people going from office to office to office, especially if you have multiple locations and you have staff that work in several locations, or you have an office manager that sort of travels from building to building throughout the week. You may want to minimize that in the short term. Now, as I said, those are the guidance or the rules that came out through the executive orders this week, the one on Monday and then the newest one today. Those are for all employers, regardless of industry. But now that healthcare got the green light to open back up next Friday, there are additional requirements specific to those of you working in dentistry. And many of these are really targeted at your interactions with your patients, but some apply to employees as well. And so I've got those listed here, but they are in the most recent executive order, which I believe is in a press release on your website too, so you can take a look at those. But it's, again, some more obvious things, right? Social distancing is something that we are trying to maintain both with employees and with patients. So you might want to look at the number of appointments that you are offering in a day so that you don't have as many appointments in a short time frame, which allows more cleaning time in between, and it minimizes the amount of patients that are passing each other at the check-in or checkout area or in the hallway. There's some requirements for posting signage, instructing your patients that they have to wear a face covering when they are inside the building. And then, of course, they can remove the face covering for the exam or for dental procedures, but then it has to go right back on again as they exit the building, unless that that patient has some sort of health condition that would prevent them from wearing that face covering. Limiting your waiting room occupancy is another key part on the social distancing side. Remove the extra chairs so people don't even have the option to sit next to each other. Consider having people wait in their cars until you call them in. Maybe you put X's on the floor at the check-in or the checkout areas to let people know what a 6-foot distance looks like. You know, a lot of the things that they're implementing in the supermarkets can be translated over to the dental practice as well. I talked about the front desk person perhaps needing a different level of PPE than your clinical staff. And that's because you might consider installing barriers that would protect your front desk staff, like stagnant barriers. So it could be a plexiglass sneeze guard almost that the front desk staff could sit behind. It could sit on top of the desk area at sign-in. When you are screening your employees, and by screening, I mean you're taking their temperature. It's one of the questions that's being asked in those health forms. Or you're taking the temperature of your patients before you bring them back to the room. Where are you going to be taking those temperatures? And is there a way that you can sort of isolate or create some barriers in that space? Should somebody test with a high temperature and then have to be sent back out the door again, not allowed to be seen? Enable contactless sign-in as soon as practical. So this isn't something that you have to have in place before Friday, but you might want to take a look at how could you have patients sign in, you know, alert you that they are in the parking lot or they're ready to be seen without having them touch an iPad or a pen, you know, with a clipboard or something like that. But it would be perhaps an app on their phone, or maybe they could do it online before their appointment. So that's something to be looking at in the future. And then another thing to kind of be looking at in the future is your hours. So just like in the supermarkets, many of them have created specific times of day that are really targeted at highly vulnerable shoppers so that they're not in with the general public. You might consider doing something like that with your highly vulnerable patients, creating special hours for them. And then here's the list continued. Making sure that you're having common screening protocols for your patients, just like you're doing for your employees. You're going to be doing it for your patients too. It does include a temperature check. So you want to get a touchless thermometer if you don't already have one. And then you have to have procedures for patients with a high temperature or respiratory systems. So when you do that initial screening protocol, if they answer yes to symptoms, you know, difficulty breathing, dry cough, or if you take the temperature and it's above, I don't remember if it's 100.1 or 100.4, but if it's above whatever the threshold is, what are you going to do at that point? Would you have a special entrance for them? Like, let's say it was an emergency case and you didn't want to turn them away. How could you treat them and minimize exposure to everybody else? Again, deep cleaning exam rooms after every patient, hand sanitizer and face coverings at the patient entrance. I thought that was an interesting one, the idea that you would have face coverings available too. It doesn't say optional here. It says place hand sanitizer and face coverings at the patient entrance. So I guess the assumption here is that if you had a patient that attempted to enter the practice and they were not wearing their own face covering, that you would have one available for them to put on. So when you're ordering your supplies, I mean, I'm not saying it has to be an N95 because it just says face covering, but you may want to order extra just to have available in case you've got patients that don't have their own. Require employees to make proper use of PPE and employ telehealth and telemedicine to the greatest extent possible. So this is a very long list, and this just came out this morning. And this is in addition to the list that came out on Monday for all employers once they were green-lighted to resume in-person work. And this is on top of the COVID-19 preparedness and response plan. Now, a lot of these specific protocols would be things that are also outlined in the preparedness and response plan. But my point is that's a lot of work that you all are going to have to do between now and when you decide to open your doors. So just because you've been green-lighted to open next Friday doesn't necessarily mean that you will be ready to open next Friday, because all of this has to be in place and you have to allow time for training of staff before you open. So I want to just take a little bit here and talk about the COVID-19 preparedness and response plan, and then I want to talk about some other things to keep in mind before you recall employees that go beyond the infection and mitigation control procedures. So just a couple of notes on this preparedness and response plan. As I said, there are free templates available. Michigan Chamber has 4 of them based on risk profile, and the Small Business Association of Michigan just came out with one as well. So those will be shared with all of you. But these plans have to be done. They have to be drafted and available by June 1st, or within 2 weeks of resuming your in-person activities. So there is a deadline on this. And in general, your plan is going to address several things, all of which we've already talked about. How you're going to ensure social distancing, how you're going to screen patients and employees, what are your protocols if somebody has symptoms or tests positive, what are you going to do about PPE, how are you going to sanitize the workplace, what hygiene protocols are you going to implement, and how are you going to communicate and train on these safety plans. That's really what this preparedness and response plan is all about. But it's due, right? It's got to be done by June 1st or within 2 weeks of when you resume in-person activities. Now, a few other things here to keep in mind before you start calling employees back. And again, I would put this under the preparation category. The first is you want to take a look at the different posting requirements that are now in place. So all of you have labor law posters that you know are required by state or federal law, and they're probably in your break room or wherever employees would see them. But there are additional notices that you now have to add to the ones you already have in place. The Families First Coronavirus Response Act that was effective beginning April 1st and is in effect through the end of December of this year. That was federal legislation. It allowed for paid leave, various reasons, various buckets of time. Employers have to post those model notices. Now, you are healthcare providers. So even though you're posting the model notices, you don't necessarily have to offer FFCRA leave to your employees. As a healthcare provider, you can exempt yourself from all of the FFCRA leave requirements if you choose to, but you still have to have the model notices posted. Some of your county health departments also have notices that they want you to post. So when you go and you look at their website to find those employee screening questions, You're also going to want to take a look and see if they have any employer or employee notices that they want you to put up. I just finished reading to you some of the healthcare specific rules in that newest executive order, and it talked about posting signage at your entrance that tells your patients they have to wear a mask. You might also want to post signage that encourages people to wash their hands. You might post signage that encourages a 6-foot distance when they're waiting in line to check in or check out. So those sorts of notices and signage, you're also going to want to take a look at and decide where in your practice you want to place those. And then, as I said, that preparedness and response plan has to be accessible to employees. You don't have to post it anywhere. You don't have to submit it necessarily, but it has to be available for employees to view. Now, one last thing before you call employees back, and that's to determine whether or not any of your workplace policies are going to change, even if it's in the short term. So I talked briefly about FFCRA leave. Are you going to comply? Are you not going to comply? Are you going to comply with parts of it? If you are going to comply, then you probably should update your handbook, or at least include an addendum that specifically talks about an employee's right to leave under that law. Again, if you are going to comply. And that would also require you then to update your time off request forms. Another thing to think through is your vacation use or your PTO. If you've been closed since mid-March, and you know that you have this backlog of patients that is going to need to be seen, and that the first 2 or 3 or 4 months you're open, it's going to be crazy busy, and you can't afford to have employees be gone on vacation, then you need to tell them that in the interim, you know, for the next 2 months or from now until whatever date you choose, we are not going to be approving time off requests, you know, so kind of think through that piece. Or if you had a PTO policy that front loads vacation banks at the start of the year, well, the assumption there was that they were going to work the full year. Well, they've not worked for 2 months out of the year. So you might have to adjust those annual PTO amounts that you might have front loaded based on actual hours worked. So kind of think through, what are all the different benefits or programs we have in place, and are we going to make any changes to those? And if so, we need to then communicate that to staff before they return. Decide what day you're going to open your doors. Again, the earliest you can open is next Friday, and that's for non-essential services. You've been able to provide emergency services all along, but for the non-essential, the earliest is next Friday. But as I said, if you're not ready by next Friday, then you can pick any date in the future. You just want to make sure you know what that date is. Make sure you've got a schedule then. Once you know the date, you can start working backwards and map out all of those lead-up activities that you're going to have in place before people return. And then decide how many people you need to return, okay? It may be that not all of the staff that you had in March are the same staff that you want to have end of May, beginning of June. You have the right to make some choices there, and Dan's going to talk about that in a little bit. Or maybe you're anticipating kind of a phased approach to reopening, a slow roll. And if that's the case, maybe you need your staff, but you don't need them all at their full-time hours or their normal work schedule. And if that's the case, if you're going to do a more phased approach, you might consider using the work-share program through the Unemployment Insurance Agency. That gives you much greater flexibility in terms of the amount of hours and wages an employee could work for you. And then those hours would be supplemented with work-share unemployment benefits versus underemployment benefits. The work-share program allows you, as I said, greater flexibility on that earning threshold. And if the employee earns even $1 in state unemployment benefits, whether it's through underemployment or through work-share, they also get the full $600 federal benefit per week through the end of July. So if you don't have enough work to offer your employees their full schedule back, and you're anticipating resistance to the recall notice because they're currently making a lot of money on unemployment, and they'd be making less than their normal wages with you because you can't give them a full work schedule, then work-share might be an excellent option. Allows you to still bring them in at an hours requirement that you can afford and that you could fill with work. without them taking a big financial hit on the backside, because they wouldn't totally lose the unemployment benefit. And I've got some documentation on that too that I'll share with all of you. So the last piece that I'm going to talk about here before I turn it over to Dan, this is kind of the second part of the presentation now, which is how do you actually call employees back to work? And I would encourage all of you that when you are ready to recall employees, that you do so formally. And by formally, I mean in writing, okay? Which is why it's so important that you've done all of the prep work, because that recall letter, and I've given a sample to the MDA, I believe it's been shared with all of you, that recall letter is going to give the employee all the information they need to know about when you're calling them back, the hours that you anticipate them working, the pay that you're going to give them, whether or not any benefits are going to be suspended, the fact that you might have training prior to that recall date in order to prepare them. You're going to refer to your preparedness and response plan and assure them that you are taking their safety very seriously. And then at the end of it, it's going to ask them to state their intentions. And this is why I'm really pushing all of you to recall your employees formally in writing, is because I want your employees to document back to you what their intentions are, right? And they've basically got three options. Option one is, great, I'll see you on such and such a date. I'm in, okay? Okay, now you know you can count on those folks. Option two is, I might not be able to come back, or I might not be able to come back by that date. And here's my specific reason why. And so it instructs them to submit a written statement as to their rationale. You need to know that, because depending on the reason why, you may or may not be obligated to try to make that work for them. And then the third option is, sorry, I decline recall and resign my position. Okay, so that recall letter is hugely important, not just so that you can plan accordingly, but also for those of you that have a PPP loan, there are pro rata reductions to your loan forgiveness based on employee headcount, unless you can prove that you tried to call the employee back and they refused to come back, right? So again, that documentation to the recall letter is going to be your proof that you made a good faith effort to bring your employees back for those PPP purposes, and that will help with the forgiveness of that loan. So with that, I'm going to turn it over to Dan. I'll still run the slides, Dan, so when you're ready, go ahead and just tell me, and then we'll go from there.
Okay, thanks, Jody. An already very busy day with two new executive orders affecting the practice of dentistry and medicine. It just got even busier. As Jody was speaking, I received word that Judge Stevens has ruled in favor of the governor in the lawsuit brought by the legislature seeking to invalidate the executive orders and the declaration of the state of emergency. So the governor has won round one, and I'm sure the legislature will be appealing to the Court of Appeals, or maybe they'll try to go directly to the Supreme Court. We'll just have to wait and see. So a very big day indeed. I'm going to address a number of questions that seem to come up over and over again in dealing with returning to work. First, I think employers have to anticipate that employees may choose not to come back to work when they're recalled. There are a number of reasons for this. They may just be afraid that they're going to become infected and decide that it just isn't worth taking the risk. They may have irreconcilable childcare difficulties that require them to be at home to care for their children without any other options. They may have a health condition, a pre-existing health condition that makes them especially susceptible to this infection, and have even greater concerns with becoming infected than somebody who is healthy. They may be living or caring for someone who has their immune system compromised, and again has a heightened concern with becoming infected and bringing that infection home to somebody else that they're caring for. Refusing to stay at home until the refusing recall based on the stay-at-home executive order is no longer a reason after this morning, because that's now all been amended, and patients are going to be free to leave their homes to seek medical and dental care now, whether it's essential or non-essential. And finally, I put retirement on here because I've gotten a number of calls from people, and this will come up again in a couple of slides from now, where you may have employees that were of retirement age or very close to it, have been sort of teetering on the edge of whether they were going to continue working or retire, and this may be just the thing that tips the balance in favor of retiring, and they may decide they're just going to retire and not come back to work. I have been counseling employees to understand the consequences of refusing recall, which include discipline up to and including termination, loss of unemployment benefits, loss of the potential to receive paid leave, among other things, and also trying to counsel employers to choose wisely who to recall and to make the consequences of refusing clear to them. Jody, if we can go to the next slide. Employers and employees alike typically want to know what effect a refusal to return to work when recalled will have on unemployment benefits. Generally, if an employee does not have a valid reason for returning to work when recalled, the employee is going to cease receiving unemployment benefits. Valid reasons in this context include being under self-isolation or self-quarantine in response to an elevated risk from COVID-19 due to an immunity compromised situation. Currently experiencing one of the principal symptoms of COVID-19 infection. And these include fever, an atypical cough, or atypical shortness of breath. Having had contact in the last 14 days with someone with a confirmed diagnosis of COVID-19. And in the healthcare setting, this means either being within 6 feet of a person with COVID-19 for a prolonged period of time without appropriate PPE, or having unprotected direct contact with infectious secretions or excretions of the patient. For example, being coughed on or picking up a tissue with your bare hand. Being required to care for someone with a confirmed diagnosis of COVID-19, or having a family care responsibility as a result of a government directive. And again, the example of this is the executive order we have in Michigan closing all daycare facilities and closing the schools, which means all of our kids are at home and have to be cared for. Reasons that are not valid include making more money on unemployment than working, which we're hearing quite a bit. Claiming it's unsafe, even after it's been explained to you that all necessary PPE is in adequate supply at your employer and all other necessary precautions will be taken, and the like. The way this process works is that When an employee refuses a recall, the employer notifies the unemployment insurance agency that the employee refused a recall. The employee is then required to make a truthful certification once every 2 weeks. And after they refuse the recall, that would have to be reported as part of that next certification. Now, if an employee continues to get benefits and the employer wants to do something about it, all they can do is to monitor their unemployment account at MyWAM. If you see that an employee that you have recalled and who has refused the recall without a valid reason is continuing to see benefits, and you'll see those benefits being charged against your account, you then can go in and make a protest and make it clear to the unemployment insurance agency, to the extent it isn't already, that a recall without a valid reason for a refusal has occurred. Ultimately, this decision, whether to continue unemployment benefits or not, is up to the unemployment insurance agency and not to the employer. We can go to the next slide, Jody. Employers also have choices to make. This includes the choice to open back up May the 29th, some later date, or not to open up at all. I've heard from some dentists in their 60s and 70s who have decided it's not worth the risk to return to work under these circumstances, and instead will be looking to sell their practices. Every practice must make this decision for themselves. If you decide to reopen, realize that you do not have to bring every employee back all at once. Your patient volumes are likely not going to be significant enough to justify this initially anyway. Instead, choose wisely who to bring back based on who is really necessary. And as part of this consideration, think about who, if anybody, can work remotely. Billing and other back office type functions come to mind. You may be better off buying laptops and having those people work from home than having them come into the office every day and running the risk that they bring something in with them or that they become infected because somebody else has brought something into the office. Choose also based on who your best performers are. Who has the most seniority? Who's the most flexible, the most cooperative, popular with patients, etc. Also consider your employees' availability to return. Remember, as Jody was just talking about, a refused recall may result in a loss of unemployment benefits. And the employee, it may leave the employee without an opportunity to obtain paid leave, assuming you're going to make it available. And we'll talk about this more in a minute. Finally, remember, as always, that the discrimination laws do apply in this context. Protect yourself by documenting your reasoning for selecting the employees you did for recall and why you didn't recall other employees. Next slide, Jody. The possibility exists that you could recall an employee who will immediately request paid leave. Now, how can this happen? The Families First Coronavirus Response Act, or the FFCRA, took effect on April the 1st, and it currently is set to sunset on December 31st of this year. Generally, it requires employers to provide paid sick leave and paid family medical leave to qualifying employees for as long as 12 weeks. That's the bad news. The good news is that this doesn't end up costing the employer anything because the amount it pays for this leave is allowed to be taken as a credit against the employment taxes that the employer would otherwise be obligated to pay. The better news is that providing this paid leave is voluntary for dental offices. This law provides two exemptions. The healthcare provider exemption is the one applicable to dental offices and applies to dentists because they're included in the definition of healthcare provider under the FMLA. As I said, this is voluntary. The law allows dentists to elect to provide paid sick or family leave and claim the tax credit if they choose. You might consider doing this in certain situations to aid employees that are no longer eligible for unemployment benefits. If they would receive greater benefits from this paid leave than they are receiving in unemployment compensation currently, as long as the employee otherwise would qualify for the paid leave. Remember also that there may be paid leave available from other sources upon recall, including your own PTO policy and the FMLA and Michigan's Paid Leave Act, if your practice exceeds the 50 employee thresholds of those acts. Next slide, Jody. Many have asked, can I require employees to attend in-person training, PPE fittings, and the like? As of this morning, the executive orders changed, but I don't think that this has affected the answer to this question. Both the prior stay-at-home order, Executive Order 2020-92, and its current version, Executive Order 2020-96, allow this type of in-person training and fitting activity. Keep in mind, though, that even when conducting this training or fitting, that the workplace safeguards that Jody just ran through, as they were updated today by Executive Order 2020-97, must be complied with. In order to do this, I think the best practice is that you follow the ADA's Return to Work Toolkit and the MDA Addendum. We think that that matches up pretty well with these new requirements in today's new Executive Order 2020-97. Also remember that you cannot require employees to do this for free. If your employees are paid on an hourly basis, you have to pay them for the actual time they spend in these training and fitting sessions. If your employees are paid on a salary basis, they have to be paid for the entire week, even though this training or fitting session are the only services that are performed during the week. So for this reason, it might make sense to wait until you're going to reopen the office, do the training on the first day of that week, and then open the office the next day and have your people come to work so that you're not paying for nothing. Next slide. The last topic I have is employee releases. And in the last few days, I think as people have prepared for this being able to open up to occur, we've really gotten a lot of phone calls and emails on this topic. Obtaining releases from your employees, especially in this context, is problematic. It has the potential to create both an adversarial relationship between you and your employees at a time when you really need them, and it may frighten away an employee that you would really like to return to work. You should also consider whether a release would even be enforceable. Would a court find that there was no consideration for the release to make it binding? In other words, that returning to work was not consideration enough, or that such a release is just void as against public policy. In my opinion, these are both very real possibilities. You should further question whether a release is even necessary, given the likelihood of an employee being able to prove his or her infection was caused by coming back to work, as opposed to all of the other ways the infection could have occurred. Whether the employee has significant enough damages to make the case worth pursuing, and whether or not the employee was contributorily negligent are also significant issues that make an employee pursuing a claim against you unlikely. The bottom line is that this is a judgment call. You may reasonably decide that give this potential for disruption and the issues inherent in an employee's claim, that you're just as well off providing notice and having the employee acknowledge the risks that exist in returning to work when they sign in each day as part of the certification process that is going to be going on. And that may be just as valuable to you as a release at the end of the day, without causing any of the disruption that is likely going to be inherent in this process. So with that, we'll turn it over to questions.
Thanks, Dan. Let's go to the first one. What is the recommendation on COVID testing employees before they return to work and on an ongoing basis?
I don't have the answer to that one. Dan, I don't know if you do.
Well, what I can tell you, it's ultimately it is a judgment call, whether you're going to require that or not. From a legal perspective, ordinarily under the Americans with Disabilities Act, requiring testing of this kind is not allowed, with very narrow exceptions. And I think that one of those exceptions is going to apply here because of the risk that is present by having a COVID-19 positive person present in your office. I believe the ADA exception is going to apply there. Of course, there's no law that says definitively yet whether or not it is, but in my opinion, when push comes to shove, that's going to be the ruling. Again, just because you can do it legally doesn't mean it's going to be the best practice for you to do it every day or every 14 days. Ultimately, that's a judgment call that you're going to have to make.
Can you explain the state's work share program and how to effectively utilize it, along with how and when it should be best used?
Yeah, so I'll take that one. So the state work share program is a program that's offered by the Unemployment Insurance Agency. And it's different than traditional unemployment benefits because work share is managed by the employer versus the employee. So the employer can set up a work share program. Actually, you can set up multiple programs within your workplace. There are some requirements. You have to have at least 2 employees assigned to each individual. They call them units. So you have to have a certain work relationship that's going to apply equally to at least 2 employees, and that could create a unit. And then you could have a different work relationship with 2 other or more employees that's different from the first unit. So for example, maybe you know that your front desk staff, you've got enough work for them initially making patient appointments and kind of filling all of that up that you could bring them back at 50% of their normal schedule. But your clinical staff, for example, you are not going to have quite as much work for them, so you're going to bring them back at 40% of their normal work schedule. So workshare has parameters. You can reduce somebody's work schedule anywhere from 10% to 60%. So it's a really wide range. And as long as you have at least 2 employees in that group that are treated similarly in terms of the reduction, and it's reduction in hours, then the employer can go on through their MyWAM account and establish a work share unit, and you enter in the employee information and you enter in the reduction that they're going to be experiencing, and employers would then certify every week if you pay every week, or you could certify every 2 weeks if you have biweekly payroll. And all the employees that you've typed in for that program automatically get a prorated portion of their state unemployment benefit in addition to the wages. And because they're getting at least $1 in unemployment benefits through the state, they also get the additional $600 per week in the federal benefit that's in effect through the end of July. So if you think about this in relation to kind of traditional underemployment, which I know many of you are familiar with because you've had employees coming in a couple hours here and there for emergencies. Traditional underemployment caps the amount of money an employee can earn with you in terms of wages and still allow them to get an unemployment benefit. And it's capped at 1.5 times their weekly state benefit amount. So at most, it's like $452 or something like that. Well, with a work share program, remember, you could reduce their work by as little as 10%. So somebody could earn 90% of their normal wages for the week, get the other 10% as a prorated portion of a state unemployment check through the work share program, plus the additional $600 in federal benefits. So they actually come out ahead using Workshare. Workshare currently is federally funded through the end of December, so it's not going to affect your account negatively. Employees can be on Workshare programs for up to 52 weeks, so longer than what unemployment benefits typically run. And the employer manages those accounts, so it's not something the employee has to volunteer to do. You as the employee can require that the employee be in that specific unit. And then as you ramp up, as those work schedules change, you can terminate one plan and then create a new plan at a higher level and run employees through that program all the way up until you're at, more than 90% of capacity.
Dan, what are legal thoughts about recalling a dental assistant that is immunocompromised on Humira, yet she wants to return and is 56 years young?
I think I would counsel her that he or she should probably not return to work, that the risks likely outweigh the benefits. And the other thing I would say is we were talking about the FFCRA paid leave and why it is, if you didn't have to, you would elect to make those benefits available. If this is an example of why you would, I think. I mean, assuming that this person otherwise would qualify for paid leave, at least you would be able to supply that for up to 12 weeks to get this person something.
Dan, can I jump in on that real quick?
Yes.
The FFCRA paid leave for a health condition is capped at 2 weeks. The additional 10 weeks is specific to childcare. But the health condition is an eligible reason under the expanded unemployment reasons. So if they didn't come back, they would most likely still continue to qualify for unemployment benefits.
Correct. The employee has got to otherwise be eligible, and that's why I said, if that was the case. But no, the bottom line is if you have employees that for whatever reason you think are very high risk, if they get this infection, my advice would be to counsel them about that, make it very clear to them what these risks are. Ultimately, as I said, pick and choose wisely who you're going to bring back to the office.
Will the 2020-97 apply to in-home childcare workers such as a nanny?
I don't believe so. That in-home childcare was not specifically allowed to resume in-work activities. And so if they're working in your home and not in their own home, right, then that, I think it's not specifically called out. I know that there was an allowance in the executive orders for childcare to open up for critical infrastructure employees. I don't know, now that certain industries have been green-lighted to go back for non-emergency situations, so like dentistry, for example, if those same childcare providers could also open up for those children. I'm not sure about that. But childcare in general has not been green-lighted in this executive order or any prior one that I've seen.
I think that's right.
Next is, this is unclear to me, but why would vendors want to see the COVID plan of action?
Well, if they're coming into your place of work to drop off supplies, you know, I'm sure they'd want to know what your protocols are so that they don't violate those. And if they're in and out of several different offices or several different drop points throughout the day, part of your plan might say, we don't allow deliveries to come in the front door. You notify us when you're here, you put them on the curb, and we come out and get them. But that's something that you're going to want to think through. And so I think vendors are going to want to understand what your policies and protocols are so that they don't violate them.
They may also be concerned about the things that they're picking up from the office and taking.
Yeah, good point.
As well.
Do you have to have your employees retake their temp after a lunch break or just in the morning before beginning the day?
I think that this is a judgment call. I mean, certainly when they report to work for the first time, whether that's first thing in the morning or at some other point during the day, the temperature ought to be taken then. Doing it again later on in the day, I don't think there's any legal requirement that you do it or not do it. If it's a quick and easy thing to do, I guess I don't know why you wouldn't do it.
Where do you if hours of operation is 8 to 5, is the afternoon considered a different shift?
Do you mean for the purposes of health screenings? If that's the question, then I think it's what Dan has just answered, that when the employee reports to work for the first time that day, regardless of what time of day it is, the health screening needs to be done at that point. It doesn't need to be done again for that same employee unless you want to. I don't think there's a prohibition against it, but there's no requirement that you do it more than once in that same day if that employee is still working.
How do we handle patients that refuse to wash hands, use hand sanitizer, or wear a mask?
Dismiss them from your practice. I mean, you're going to have these rules. They're going to have to be applied strictly and in all cases. And patients can either comply and get the services that they need or want, or they can leave and seek treatment somewhere else, if there is another office that would tolerate such a thing.
After completing the patient or employee health questionnaire, does it need to be retained?
Yes.
Yes, and for the employee health screening, don't put it in their personnel file. Put it in a medical file, or put them in one, lump file that has restricted access. You don't want these kinds of questions and answers to these kinds of questions to be mixed in with other general employment information that might live in the employee's personnel file.
Yeah, this is all protected health information, and HIPAA and other laws apply to it. So it's got to be kept confidential and out of the eyes, or protected from disclosures by other employees that may otherwise have access to an employment file.
Yeah, so you don't want to have one master sign-in sheet, for example, that everyone puts their name in the morning and then checks all of the boxes, and then the next employee comes in and on the same form, second line down, does the same thing. You don't want to do that.
Can you give a little more detail on how we exempt ourselves from FFCRA, and if we don't comply, are we going to get in trouble?
Well, I don't think you have to do anything to exempt yourself. Just you are not, the exemption applies to you already, and you're under no obligation to provide the paid leave. And so any employee that doesn't understand that and asks for the leave, I would just tell them that you've elected not to provide it and you're exempt from the law. I don't think you need to do anything in addition to that.
Yeah, and you don't need to advertise to your employees that you aren't planning to offer it. You can simply wait until someone requests it and then at that point indicate. But if you're not going to offer it, then make sure you're not including language in a handbook or updating time off forms that would give somebody the impression that you are going to offer it. So just make sure you're consistent.
Can we start back with full staff and then go to work share if demand slows down?
Yes. Yep.
Can the formal recall notice to employees be an email, or does it have to be mailed to them?
I've had employers email it and then just have the employees sign, like they type their name and then they put e-sign after it or something like that. I think it can be done electronically so long as it's in writing. I would make sure though that you have a return date, a date that you need to have their response by. And as Dan had said, and what will happen to them if they don't respond by that date? How will you interpret that? And I believe the recall template that I created says it's considered a voluntary resignation if there's no response.
Are we able to bring staff back prior to the start date of May 29th for training? I was hoping to do staff training on Tuesday through Thursday before the Friday launch.
And I think the answer is yes. We talked about that. You do have to pay them, and you have to follow all of the workplace safety requirements in the latest executive order. But yes, you can.
What if employees want to donate their time so they can stay on unemployment?
No. No, you're going to run into some sticky situations with the Fair Labor Standards Act when you are performing what you would typically be paid for and be considered work, and yet now you're not being paid for that. Nonprofits run into this a lot. Employees want to donate time, and when it lines up with your typical work duties, that's a problem.
That could be a problem with the unemployment insurance agency also, especially if you're acting in concert. It's problematic for both the employer and the employee. I would not recommend anybody do that.
If we return to work on May 29th, how do you recommend paying the employees? They'll be certifying that week for unemployment.
Well, when they certify, they're going to be asked a series of questions, and one of which will be, did you perform any work for the week in which you're certifying? And so if Friday is the tail end of a certification week and Monday through Thursday they did no work, but Friday they did, they would answer, yes, I performed some work, and then it will ask them about the wages they earned. And so if they worked only Friday and they didn't work any other time that week, they'll most likely be under that 1.5 times the weekly benefit threshold. So they could receive wages, they could still receive a portion of an unemployment check for that week and the $600 federal payment. And they weren't fraudulently obtaining that. They answered the certification questions honestly.
Once a vaccine is available, may a dentist require his employees be vaccinated as a condition of continued employment?
I believe the answer is yes, and I think that's there are examples of that already. I think healthcare workers in particular have to have all their immunizations up to date, and if you're asked to provide proof that all your immunizations are up to date, an employer can do that legally as well. So this would just be one more immunization on that list.
Is the acrylic panel at the front desk mandatory?
I don't think it's mandatory. Read the executive order to make sure. It does say to set up physical barriers, you know, when appropriate, but it also says that you maintain social distancing and that you have appropriate PPE. So if the plexiglass sneeze guard just isn't going to work in your practice, and you know that you can keep patients 6 feet away from the folks at the front, and you're both wearing masks, then you're fine. But if that wasn't possible, then the sneeze guard is an option, or it could be one more layer of protection. Same thing with face shields. You might have some folks at the front desk that are asthmatic, for example, and would really struggle with a face guard or a face mask. So then you go to risk profile, and as long as those other precautions are in place and they're not in a high risk position, perhaps a face shield versus a face mask would be an appropriate substitution for them. So you've got some flexibility here.
If an employee is counting on a family member for childcare and that family member is unavailable, not COVID related, do they qualify for the expanded FMLA Families First Act?
I think that they would. If it's your child and you have to be home to care for that child, I don't think it matters why, or that you had coverage because a relative was helping you out and now they cannot. If you have to be home and away from work to care for that child, you would be eligible for the paid leave.
Does the employee need to already be signed up for unemployment to do work share? I have one employee that worked and never went on unemployment. Will she have to apply for unemployment first?
No, this is an employer-run program, but they would have to be eligible to establish a claim. So there are still rules around earning thresholds and some of those things. If she had applied on her own for unemployment, some of the rules and thresholds on employment would have applied to her scenario. They're going to still apply to her scenario, but she doesn't have to apply in this case. The employer does that on the employee's behalf.
If we have an employee who travels out of state or on a plane, do we have to require them to self-quarantine for 2 weeks?
I believe the CDC has guidance on that. For example, when I pull the Ingham County Health Department's health screening form, one of the questions that is asked on that form is, in the past 14 days, have you traveled internationally or domestically? And then it instructs you that if they answer yes, that they self-quarantine for 14 days. So I really think it's the CDC and the county health departments that are going to have the final say on that.
And I believe that is the CDC guidance, that before you return to work, if you've been on an airplane, you self-quarantine for 14 days and be symptom-free before you come back.
And that time could be unpaid unless you allow them to pull from a PTO bank, or unless you decide that you're going to comply with the paid sick leave provision of FFCRA. Self-quarantining is a qualifying reason for those 2 weeks of paid leave. But absent that, the 2 weeks would be unpaid. Now, they could most likely qualify for unemployment for those 2 weeks, potentially, but.
Are specialty hours for high-risk population required? If so, are there specifications such as, does every day have to have a specialty hour or just every week?
Go ahead.
Right now, the guidance isn't clear. This is simply the executive order, and then the executive order points to different regulatory agencies that will be coming out with more specific guidance. And I think in this case, it's licensing and regulatory affairs that's going to be issuing guidance on this most recent executive order. So for now, it just says, you know, offer hours for at-risk patients. It doesn't say how many, how often, But I think more guidance will probably be forthcoming on that.
Okay, it's 8:15, but I think we have time for one more question. Our assistant accidentally called her unemployment laid off instead of due to COVID. I've been trying to get this changed. Is there a tip for me to get this changed?
Here's what I'm going to tell you. One, you could attempt to go in through your MyWham account, and I believe I've shared instructions in my videos, and on my website there's instructions too, kind of step by step on how to protest a charge. And you could potentially go in and protest a charge, and the protest reason would be basically she put the wrong reason, it should be this. So that's the employer trying to get unemployment's attention that says, hey, you know, don't stop the payments, but make sure you've got the right reason in your system. So there is that option, but I've heard from unemployment that it's not necessary at this point, that they've pushed all of this to a non-chargeable account. And even though you might be getting notifications that says a portion of these charges are being put against your account, what I heard the director of Leo say was that, well, we weren't prepared for unemployment to be opened up the way it was and the timing of all of that. And so we were inundated with new claims. So there were parts of our process that we just didn't have time to stop or fix. And the automatic generation of an employer notice that says, hey, so-and-so filed for claims, and this is how much is going to be applied to your account. That's an automatically generated part of the claim process. And unemployment just didn't stop that initially. So you might be getting documentation that leads you to believe your account is being charged, but UIA over and over again has affirmed that that is not in fact what's actually happening on their end. So I don't know that you have to fight too hard on this, but I guess keep an eye on your actual charges, and when this whole thing sort of clears, if there's anything on there that shouldn't be, then you can go back and fight it at that point.